Namaskar everyone. Myself Dr. Sahil Gupta, homeopathy physician, drug addiction counselor and mental health counselor. As you all know, we are making series of videos on different topics. So last time we have made the video on drug addiction. And we discussed about basics of drug addiction. So we will continue from that. We'll further go different types of drugs. We'll start from the tobacco. So we'll continue from this types of addictive substance. It is divided into classes, different classes. There is chemical class, which is further divided into alcohol, opiates, cannabis, stimulants, cocaine, sedatives, hypnotics, hallucinogens, and tobacco. There are different types of addictive substance which are further divided, and the action is different. Depressants, alcohol, cannabis, opiates, and sedatives. These, when we taken, it will act in our body as depressants. And next is stimulants. Stimulants usually which stimulates our mind, that is cocaine, tobacco, caffeine, and amphetamines. Next is hallucinogens, LSD. We'll further discuss. First one is alcohol. When a person is under the influence of alcohol, as we all know, is a brain depressant. When a person takes in a small quantity, it will relieve anxiety. It may also give a sense of strength and results in boisterous behavior. It heightens the mood prior to intake, be it sadness or happiness, impairs judgment and the performance of the person. Next, we'll discuss about opiates. Substances with opium-like effects are called as opiates. In Afghanistan, Myanmar, these are the world's largest illegal opium-produced countries. In India, it is produced as a legal, as we all know, this is also used in the medicine productions with illegal permission from the government. This is the opium. This is chemically synthesized heroin and smack, which is very common these days. Then next we come to opiates classifications. Natural, it's morphine, codeine, and thebaine, which is used in medicine production. Synthetic, further divided into methadone, dextropropoxyphene, fentanyl, pethidine, pentozocaine. Then semi-synthetic, which is chemically produced as heroin, buprenorphine, oxycodone, hydromorphine. What are the effects of opiates? Act on specific receptors in the body. Opioid receptors produce narcosis, a state of stupor, dullness in the brain. Person is like a semi-conscious or half-conscious. When a person is used these type of drugs, first use is unpleasant, associated with nausea, vomiting, itching. Varies from person to person. It is also having analgesic properties, euphorogenic and sedative properties. What are the effects of opiates? Usually it affects gastrointestinal, nausea, vomiting, anorexia, constipation, and respiratory, and in sometimes cardiovascular effects also. Few cases, when a person is severely addicted from 1 to 2 years, and after a few years of continuously intake, as resistance is developed, but we don't know, as this is the only drug where we don't know when will when will be the last dose of the persons who is taking heroin, as this is very dangerous drug. The skin is very warm and the flesh when a person is taking opiates. Another, ejaculation is delayed. These are the common uses legally. Legal uses: analgesia, post-operative pain conditions like morphine, dextro, propoxypine, pentazocane, buprenorphine. It is used in the emergency hospital and the common painkillers. Palliative care, morphine for pain relief in cancer patients especially. Cough suppressants, uh, codeine, oxycodone, diarrhea medicines, GIT drugs like loperamide and difenoxaclate. In heart failures, like severe heart failures, morphine injections to save the as a life-saving drug. In modern medicine treatment, it is used as a in opiate dependence and addiction patient. Next, we will come to cannabis, which is also known as bhang, charas, ganja, hashish. It is very common in India, easily available. See how people are using cannabis in the name of God Shiva. This is very common. I generally used to see patients in my clinic, and it is very common these days, especially the truck drivers and those young blood, young generation. When a person is used this drug, it produced a dreamy state with an increased tendency to fantasize, state of euphoria, well-being, and enjoyment, generally followed by a period of drowsiness, perceptual and sensory distortions, can prolong reaction time and impair coordinations. Sounds and colors may become more intense. Person is restless, he feels restlessness, fear, and even panic may spoil the experience. It's like a bad trip for him. There may be driven activity subjects known that fun activities are meaningless, yet it's unable to control them. It's like a half man. So, friends, so we'll discuss this in the next session, sedatives and hypnotics. So, friends, thank you for watching this video. We will continue our next session with the next drug in detail, and we will continue that further in detail, all about drugs and the treatment, and in detail the menace of drug addiction, which is affecting our youth, our present generation, not only in the Jammu and Kashmir in India but all around the world. So, friends, thank you for watching. I hope you will continue your support and please subscribe the channel. Thank you so much. God bless you all.